Hello, and welcome to our next connected webinar, Anxiety, the Roller Coaster Ride, What It Is and When Is It a Problem? So my name is Peyton Jeffsinski. I am our Behavioral Health Program Administrator here at God's Love We Deliver and on the Connected Veterans Program. And this presentation was made as well with Lori Gaskell, who is God's Love We Deliver's Director of Population Health. So to start, I think a really great summary of anxiety is how it works within our brain. And that can be a very complicated topic, but it's actually not as complex as you might think. And I believe that this video does a really great job at explaining what's going on in our brain when we are feeling things like fear, worry, or anxiety. So we're going to start with this quick video.
We live in a culture that doesn't take mental health issues seriously. There's a lot of stigma. Some people tell you to just suck it up or get it together or to stop worrying or that it's all in your head. But I'm here to tell you that anxiety disorders, they're as real as diabetes. Hi again, it's Dr. Jen, and I've noticed something with my patients. They often describe to me some classic symptoms of an anxiety disorder: constant worry, trouble sleeping, tense muscles, and struggle with concentrating. But they aren't getting treatment. There's a lot of issues with mental health care in this country. Some people don't have insurance that would cover it. Some have been dismissed or minimized in the past and don't think seeking help will do any good. Some worry about the stigma and whether it could affect future jobs or relationships. But severe anxiety isn't a moral or personal failing. It's a health problem, just like strep throat or diabetes. It needs to be treated with the same kind of seriousness. Before we can talk about anxiety disorders, let's talk about anxiety itself. Anxiety is the very real and normal emotion we feel in a stressful situation. It's related to fear, but while fear is a response to an immediate threat that quickly subsides, anxiety is a response to more uncertain threats that tends to last much longer. It's all part of the threat detection system, which all animals have to some degree to help protect us from predators. Anxiety starts in the brain's amygdala, a pair of almond-sized nerve bundles that alert other areas of the brain to be ready for defensive action. Next, the hypothalamus relays the signal, setting off what we call the stress response in our body. Our muscles tense, our breathing and heart rate increase, and our blood pressure rises. Areas in the brainstem kick in and put you in a state of high alertness. This is the fight or flight response. There are ways the fight or flight response is kept somewhat in check, with an area of higher level thinking called the ventromedial prefrontal cortex. It works like this. If a person sees something they think is dangerous, like a tiger, that sends a signal to the amygdala saying it's time to run. The ventromedial prefrontal cortex can say to the amygdala, hey look, the tiger's in a cage. You know what a cage is. They can't escape from a cage. It's okay to calm down. It's a feedback loop that can help keep the response in check. The hippocampus is also involved. It provides context, saying things like, hey, we've seen tigers in cages before. We're in a zoo. You are extra safe. With anxiety, these threat detection systems and mechanisms that reduce or inhibit them are functioning incorrectly and cause us to worry about the future and our safety in it. But for many people, it goes into overdrive. They experience persistent, pervasive anxiety that disrupts work, school, and relationships and leads them to avoid situations that may trigger symptoms. Anxiety disorders are not at all uncommon. Based on data from the World Mental Health Survey, researchers estimate that about 16% of individuals currently have or have had an anxiety disorder. These include social anxiety disorder, panic disorder, agoraphobia, and phobias. Studies have shown that people with anxiety disorders don't just have a different way of reacting to stress. There may be actual differences in how their brain is working. One model describes possible mix-ups in the connections between the amygdala and other parts of the brain. The pathways that signal anxiety become stronger, and the more anxiety you have, the stronger the pathways become, and it becomes a vicious cycle. The good news is that there's treatment for anxiety and that you don't have to suffer. Remember, this isn't about weakness, it's about changing brain patterns. And research shows that our brains have the ability to reorganize and form new connections all throughout our lives. A good first step is to do the basics. Eat a balanced diet, exercise regularly, and get plenty of sleep, as your mind is part of your body. It might also help to try meditation. Instead of our heart rate rising and our body tensing, with mindfulness and breathing, we can slow down the fight or flight response and improve how we feel in the moment. Cognitive behavioral therapy, a form of talk therapy, can also be fantastic. In it, you learn to identify upsetting thoughts and determine whether they're realistic. Over time, cognitive behavioral therapy can rebuild those neural pathways that tamp down the anxiety response. Medication can also give relief in both the short term and the long term. In the short term, anti-anxiety drugs can downregulate the threat detection mechanisms that are going into overdrive. Studies have shown that both long-term medications and cognitive behavioral therapy can reduce that overreactivity of the amygdala we see in anxiety disorders. High blood pressure and diabetes, they can be treated or managed over time, and the same is true for an anxiety disorder too.
All right. Thank you for sitting through that video. I thought that Dr. Jen did such a great job at walking you through the distinct experience of anxiety, a feeling that we have all felt many times, every person feels and should feel at times in our lives. But the point that anxiety can become a disorder or a severe experience that inhibits your daily life. So my favorite part about this video and why I think it's important to show is how Dr. Jen equates an experience like anxiety disorder with something like diabetes. So here at God's Love We Deliver, we were founded in 1985 to serve people with HIV and AIDS, right? And then we extended our diagnoses. We realized that there are many physical conditions that people go through that inhibit their ability to cook or eat nutritiously, right? Or go shopping. And so we've extended those. We serve a range of diagnoses. Many of you watching are people with broad experiences with cancer, diabetes, COPD, dementia. We have a broad range, but we recognize that there are also these things that go on within our brain that inhibit us in the same way. So I love how she walks you through the different connections that your brain makes and how it responds, tells your body how to respond. And that sometimes when those messages aren't working the way that they should, that's your body creating your anxiety. I think that helps us take away some of the stigma of a mental or behavioral health condition and remind ourselves that this is a condition, an illness, right? An inhibitor, just like something physical happening in your body, like diabetes or kidney failure. So I want you to use that perspective as we begin to talk more about anxiety here today. So, some causes of anxiety. There are natural causes. There are things like stress, environmental factors, health issues, a history of trauma, your genetics, conflict, experiencing loss, or a poor diet. So some of these things, right, are natural. We experience stress at many times in our lives. Maybe we have hard jobs. Maybe we're going through a change. I know I've moved. That's a very stressful experience. There are environmental factors, things like heat waves or blizzard colds. We've experienced both in New York this past year. Um, of course, natural disasters are environmental factors. Experiences maybe in your home, you can have health issues that inhibit or that worsen your mental health. So, something like heart disease or diabetes is prone to making people more anxious because now you are aware of your physical condition. With something like diabetes, you're constantly having to manage your blood sugar. You might be having to dose insulin, and it's something to be aware of, which can make you more anxious. A history of trauma or genetics are all about where you've come from. So if you had traumatic events in your childhood, that can create an anxiety disorder. If you have anxiety running throughout your family, there's a chance that it can be passed to you hereditarily. So that's something to be aware of. Investigate your family history if you haven't, or if you have children, educate them on your family history because that could tell you the difference between being maybe an overly anxious person and somebody with an anxiety disorder. Conflict and loss are two very hard experiences. Our interpersonal relationships are very important to us as people. They're very important to our regulation, to our sense of stability. And if we lose somebody close to us that we love, that is an incredibly difficult experience. And the way you navigate the world afterwards is entirely different, right? If you lose a spouse or a parent or a child, a caregiver, your facing all of these new situations with a newfound anxiety because you don't have that level of support you had before, or that person that you relied on, or that, took care of things. And then finally, poor diet is something to consider. We've talked in different webinars about how what we eat and our nutrition feeds our brain. It helps regulate our mood. It helps improve our energy levels, our cognitive function. And so, poor diet and a lack of nutrition can absolutely contribute to the experience of anxiety as well, which is why our medically tailored meals are so important. And some risk factors, some other things that put you at risk of developing anxiety or worsening your anxiety. Again, the experience of trauma. This is something out of our control. You don't know what that could look like. That might be an experience with a car accident. A loss can be a trauma form as well. Some sort of history of abuse or violence, even seeing it, not experiencing it. Those are all traumatic events that can worsen your anxiety. Really just change your perspective of the world and how you navigate it. Again, an illness or a health condition. If you are already diagnosed with some sort of chronic illness or health condition, you are more likely to develop anxiety as a result. Work, financial stress, a mental health condition. If you are diagnosed with depression, you are more likely to experience anxiety. Other forms of mental health conditions, particularly PTSD, are also linked with anxiety. So that's something to be aware of if you know that you have a mental health diagnosis. Again, hereditary passing or drug or alcohol use or misuse is also a risk factor. So a lot of people look to drugs or alcohol as forms of coping with anxiety. You'll oftentimes hear people say that they're calmer after a few drinks, right? Though even the physical effect sometimes of alcohol or drugs can help, stabilize if you're shaking, slow your breathing. They're depressants, right? So they mellow you out. But at times, drug or alcohol use or misuse can actually worsen your anxiety in the long run because you become reliant on it and it regulates your body for you. You haven't developed that ability. So, drug or alcohol use or misuse is something to be aware of as well. We have symptoms of anxiety. You know these, just like she said in the video before. You've experienced anxiety before. You can recognize the symptoms. I like her analogy, a little silly, about seeing a tiger in the zoo, right? And your brain first recognizes it's a tiger and that you're probably in danger. But then you can zoom out, see the context, and recognize where you are and regulate those symptoms that your body is feeling. So, the most common symptoms of anxiety are heart racing, sweating, you might have difficulty concentrating, muscle tension. All of these things is that your body is preparing to respond to something, almost like you're in danger, right? But it's not fear, it's the unknowing, it's uneasiness. You might have trouble sleeping or trouble eating, whether that is too little sleep, that's most common, or too little eating. You're trembling, you're breathing very rapidly, and you're having constant feelings of worry, even if nothing is, going on in that moment in time. You might be having a normal day, nothing's thrown off, but you're having this constant feeling of worry. And again, some of these things are forms of normal anxiety. Normal anxiety helps you face things that you're struggling with, and it's normal to worry over the loss of a loved one, to worry about health problems, finances, moving, experiencing, loss or concern for somebody, or other changes that are out of our control, right? The world is a very complex place. Life is a very complex experience. There are many things that happen to us that make us feel anxious. Back in school, maybe a big test or a big presentation was one of the first experiences of anxiety you can remember. And then you learn as you get older what things really make you anxious. And anxiety is not always bad. We talk about it often as a negative experience, and most of us don't enjoy feelings of anxiety, but it's something that we are made to experience so that we can get up and make changes, right? Like that same example, our body has learned to respond to things because if we see a tiger and we're not in a zoo and it's not in a cage, our body knows that we need to run, right? We need to flight or fight. But in our day to day lives, that should not be the experience we have. And that's the point where anxiety passes a line into a condition where it's taking over your life and it needs to be addressed. So if you're recognizing that your anxiety is from a passing event, from something you're nervous for, maybe a doctor's appointment that you're anxious for, getting results, and it doesn't pass, right? That's where we start to zoom out and look at your anxiety as a whole. And anxiety is specific also for veterans because of your unique experiences. Veterans are at a higher risk of anxiety due to different elements of their service or past service. For instance, combat. Many people who have experienced combat will go on to have PTSD diagnoses or panic disorders, experiencing panic attacks at triggers. Often those triggers are loud noises or jarring, triggering visuals that might remind them of time in combat. There's also an element of transition and uncertainty. When in the service, you are transitioning to, like, you're getting deployed out or you're returning back to society and you're adjusting. And transition periods for all people are very stressful, but this is very unique. It's very unique to go into a very specific community in the service or to leave that and return to broader society, knowing that many people don't understand what you've just been through or what you've experienced. And at times, our community and our social system was not built to accommodate veterans. So that transition and that level of uncertainty fed anxiety in many, many people. There's also, again, deployment and concerns with your lack of control or safety. A lot of times, people with anxiety, they have the urge to control things, right? You manage your own schedule. If leaving the house makes me anxious, I don't have to do it. If going to that appointment makes me anxious, I'm not going to do it because you want to control your circumstances to respond to anxiety. But with an experience like deployment, that's out of your control and the circumstances are out of your control. And that really can make people anxious about their level of safety or the decisions made on their behalf. There's also survivor's guilt. That is the anxiety of looking back and maybe feeling the guilt that you have overcome or gone through situations that others maybe did not survive. That is a really unique experience to veterans and something that there's still a lot of stigma around, and that can make people feel very anxious, especially because they're often holding in those feelings. They're not talking to other people about survivor's guilt, they're not exploring it with their loved ones, again, because it's guilt and there's stigma around it and that worsens somebody's anxiety when you're holding it in. And then again, finally, there's stigma. We have a history of under acknowledging mental health conditions, especially within the military service. And so people are made to try to push their symptoms down or, not make a big deal of them, not seek treatment, not discuss it. And that only worsens your symptoms, right? The best thing you can do is learn how to cope with them, learn how to address them, and seek treatment when appropriate. So when is that appropriate? When does my anxiety become a problem? If you are mourning or you are moving or you are preparing for bad news or a specific experience that is making you particularly anxious, and that event comes, that event passes, and you find your anxiety decrease, that's normal run-of-the-mill anxiety. Like we said, it's a roller coaster. There are highs and there are lows. But if you find that those types of events aren't even happening or they've already passed and your anxiety is still building, that is when we know we've crossed a line. So you should start to think, are my symptoms of anxiety disrupting my eating, my self-care, or my ability to answer the phone, right? These are just three things that are part of daily life. Eating, answering the phone. If you're a client of God's love, we know that that's an important thing. That's how we communicate with you or get your deliveries to you. Um, and self-care, brushing your teeth, managing yourself, keeping yourself hygienic. Those are important. And if your anxiety is making you maybe overly anxious about those things or holding you back from fulfilling those needs, that's a problem. If your anxiousness has become disproportionate to the trigger, that's another a sign of this. So again, the trigger might be something, we'll use this scenario of the tiger in the zoo. If the trigger is seeing that tiger, and that's a very, scary sight at first, you might forget where you are, you might respond with anxiety, and you zoom out and you realize, I'm in the zoo. It's okay. This tiger is safe. I'm here to see it. It can't hurt me. But your anxiety lasts all day, maybe into the night. Maybe you have trouble sleeping, right? Or you have trouble eating the next day because your body's still feeling that anxiety. That's disproportionate to the trigger. In that scenario we shared, that would be a few seconds of anxiety before your body's able to regulate back. So, again, a silly example. It's most likely not a relatable one. But when you think about These normal triggers we experience that make us anxious, and your anxiety is lasting far beyond them, or your anxiety is way too severe for this thing that's making you anxious, that's a sign that, it's time to seek help. If your symptoms are disrupting your joy, like time with friends or attending a party, I talk about it in every single webinar if you've seen the others, but socialization and seeing others, speaking with others, our friends, our family, people we know is so important. It's important for our mind, body, spirit, and soul. And so if your anxiety is taking you away from those situations, that's a problem. Many people experience specific forms of anxiety, like agoraphobia or social anxiety, that is specifically about the interactions with others, where things like spending time with friends or attending a party become very daunting tasks that they want to shy away from. So if you notice that you're doing that, you're socially withdrawing or isolating, that's a sign to seek help. Also, again, losing sleep or you wake up in the middle of the night with feelings of anxiety. Unless you know you were having a very bad dream, to be woken up in the middle of the night with these feelings is a concern. That means that those feelings are staying with you, right? Even in the time we're supposed to be rebuilding ourselves, our energy, and our rest levels. So let's say maybe some of these struck a chord with you. Here are some things that you can do today to help alleviate your anxiety. You can set a routine. We have a whole webinar, Routines Moving and Grooving. I encourage you to watch it if you're interested in routine setting. It's very beneficial for your mind to have a routine, know what to expect. Again, a lot of anxiety is about uncertainty. So if you know what your day looks like and what your tomorrow looks like and the day after that, even in a basic routine like a wake up time or a meal time, there's comfort to your body that can help reduce your anxiety. Things like meditation, yoga, and exercise are very important as well. They sound very daunting, but this can be very inclusive. Meditation can be as easy as slow breathing. Yoga can be as easy as stretches in your arms when you're sitting in a chair, as well as regular exercise at your ability level. Um, Many people that I speak to experience physical therapists or occupational therapists, and they, are recommended very small exercises to do at home, like lifting your ankles up off the ground when in a chair, or recovering from an injury, you might be recommended stretches or exercises. It does not have to be going to the gym and lifting weights and doing bench presses. Exercise is all about your own ability and what's moving your body and soul. So for many, this is walking outside. Resting when you need to rest is very important. Recognizing that if you woke up in the middle of the night with feelings of anxiety, you might need extra rest that day. You want to give your body the rest it needs to help you stabilize. Getting outside to experience nature. When it's a nice day outside and you get the opportunity, it's very good for ourselves to breathe in fresh air, to see, grass, to see trees, to see green, hear birds if you can. Those are very soul nourishing experiences, and it makes you feel more connected with the earth, and that makes you feel less anxious. I know it sounds a little woo woo, but it is very, very beneficial. Seeing a therapist and medication are also another form of treatment. That's something that Dr. Jen spoke about in the video earlier. This is not always, encouraged for everyone. This is something that would be evaluated by a psychiatrist or a therapist. There are also things like support groups, specifically veterans anxiety support groups. So you can get as specific as you'd like in terms of sharing this experience with others and really giving power to speaking about your anxiety. That's what will change the game. Making plans with friends, again, trying to stop yourself from socially isolating, joining a club, or doing something kind for somebody else. These are all examples of things that today, if done, might help you start chipping away at these feelings of anxiety as you make a broader plan. Something else I wanted to point out is there is this very well known 333 rule of meditation. Again, meditation sounds like it might be a very big undertaking, right? That might be an hour and you're in a very specific position and your mind is guiding you through these scenarios, but that's not always the case. Meditation can be very simple and very fast. It is all about taking the things that you're feeling internally and grounding them to the reality you feel. So if you have ever experienced something like a panic attack, you'll know that you're very in your head, right? Sometimes your eyes go blurry, your breathing is so rapid, you're stuck thinking about your thoughts. You might not even recognize what's going on around you, right? You might forget where you are or who's with you, or if people are passing, you're not even seeing them because you're so internally focused. So something like the 3-3 rule helps you ground yourself to reality and stay aware. And this is good for reducing your panic attacks or limiting your feelings of anxiety, and also good for your safety given where you might be feeling these things. So, when faced next time with a feeling of anxiety, try to immediately name, even speak it out loud, write it down, 3 things that you can see, 3 things that you can hear, and move 3 different parts of your body. Maybe your fingers, your toes, try to wiggle your nose, anything like that. That kind of rhymed. You could do that. Anything like that helps you remember who you are and where you are and what's going on. I recommend this if you're ever having these feelings in public, in a public setting where you don't feel you can, lie down and work through them. You feel like, okay, I'm in the middle of a store or I'm crossing the street and I need to be grounded right now. I need to be safe. I need to be alert. This is an immediate response to anxiety or panic that is very effective. And finally, how to ask for help when you need it. Your primary care provider, your medical care team should be able to provide you with a list of therapists that are within your healthcare network. So please, if you haven't, reach out to them right away, right? Your PCP won't be the person that is providing you therapy, but they will have in network referrals for you and can recommend a provider even based on what they know about you. If you don't have a physician to call, you can use New York City's findhelp.org and search by your zip code. They will have a lot of resources for therapists. And I encourage you to think about finding a therapist that meets what you're looking for, right? Maybe somebody you can have preferences of age, of gender, of experience. You might look for somebody who specializes in treating anxiety if that's what you're looking for after this webinar. You might even find people who specialize in veteran services. So be specific on the website. You'll be able to find what you're looking for, but I recommend that you start early because finding a therapist can take some time. You might do a few consultations with different ones to try to figure out, right, who seems to be working for you. You want there to be a good connection, and oftentimes, right, there are waits to be seen. So I encourage you to start early. If there's even something in your mind right now saying, maybe I should consider that, I encourage you to just start. Schedule your first thing. It will probably be, at least a week out and give you some time to reflect on it before you begin. But if anything to take away from this, please be aware of your symptoms and do not be afraid to ask for help. You can always reach out to connected@glwd.org right here. That is an email directly to the Connected Veterans team. We are who you see your webinars from, you receive your newsletters from, and we help fund your meals. So please always reach out if there are issues, both with your own self, if you're looking for any other help, getting other referrals for services, you're in need of some emotional support, or if you're having any difficulties with your meals or your nutrition, you can always reach out. Thank you very much for being here today. Have a good day.